This video is going to look at the psychological explanations of schizophrenia. So if you look at your specification, there's two main areas you can get asked a question on: family dysfunction and cognitive explanations. So you could be asked an overall general question about the psychological explanations of schizophrenia, or you could be asked an essay on family dysfunction or an essay on cognitive explanation. So it's really important you know these inside out. So firstly, we're going to look at the AO1 for family dysfunction. So in family dysfunction, we're going to look at three different areas, but all of them link schizophrenia to living in a dysfunctional family. So we're going to look at the schizoprenogenic mother, the double-blind theory, and expressed emotion. So the schizophrenic mother basically means schizophrenia-causing mother. Okay, this is where the mother is someone who is cold, controlling, and rejecting. And what that can mean is it creates a certain type of family climate. And that family climate is going to be characterized by things such as tension, secrecy, children not wanting to give away their secrets, very tense environment in the home. And what this leads to is a distrust between the mother, the child. And that can develop into paranoid delusions and ultimately schizophrenia in the child. The double-blind theory focuses on the importance of communication within the family and communication styles. And it's usually where a child receives contradictory messages from their parents. So an example would be a mother telling her son that she loves him, but at the same time turning away in disgust. And what this means is it reduces the child's ability to respond to their mother because they're getting mixed messages. And these mixed messages sort of invalidate each other. The mother's telling the child she loves him, but at the same time turning away in pure disgust and hatred of the child. And this is really important, this mixed and contradictory message, because this is what prevents the development of a coherent construction of reality. The child grows up not really having or developing a perception of what reality is. They're hearing one thing but seeing another. I love you, but you look like you hate me. And it's this sort of contradictory message that will manifest itself into schizophrenia later on in life. And another example, just to make sure you're clear on it, would be a father who complains about his daughter not showing him enough love, not showing him enough affection, but at the same time telling her she's too old to hug him when she tries to be affectionate. So they're getting that double message, that mixed message. The third family dysfunction we're going to look at is expressed emotion. And this is where you get in a negative emotional climate within the household, and it's called expressed emotion. And EE families generally talk to a schizophrenic patient in a very critical or hostile manner. They'll be very nasty, they'll be very critical of what the patient's doing, they'll be very cold and condescending in what they're saying. And high EE families, or expressed emotion families, generally will be the families that talk more and listen less to a schizophrenic patient. So they'll talk, but they won't really listen to what the schizophrenic patient is trying to say. And if you found that those patients that live or are surrounded by high EE families will be 4 more times more likely to relapse back into schizophrenia when they're starting to recover. Okay, so expressed emotion is really an important factor in causing schizophrenia. And schizophrenics has been found have far lower tolerance for this type of environment. They can't handle the intense environment that high EE families bring with them. All the emotional comments, the criticism, the hostile environment, they have a far lower tolerance for that. And what it does is it means that this leads to high levels of stress in the schizophrenic individual, and their coping mechanisms can't cope with this high level of stress. So what it results and triggers is schizophrenia. Now we're going to look at the AO1 for the cognitive explanations. Remember, back to last year, the cognitive theory is all about faulty thinking and information processing. So we're going to be looking at that and how it causes schizophrenia. So the cognitive explanation focuses on dysfunctional thought processes and mental processing in particular. And schizophrenia itself has been linked to several different types of abnormal information processing. So it's not just one faulty abnormality going on, there's lots of different cognitive abnormalities occurring in schizophrenics. So there's been, to give you an example, reduced processing in the ventral striatum is associated with those negative symptoms of schizophrenia. So things like speech, poverty, avolition. So they're linked to faulty processing in certain particular areas of the brain. So a key part of the cognitive explanation for schizophrenia is that there's two types of dysfunctional thinking with schizophrenics. And the first one is meta-representation. Meta-representation occurs in all people, and it's basically our ability to reflect on our thoughts and feelings and behaviours, and also our ability to interpret the actions of others. So we see someone doing something, when we're interpreting that information, that is called meta-representation. And also, when we start thinking about why we did something, we know it's a product of our own thoughts. That is meta-representation. In schizophrenics, there might be dysfunction in their meta-representation, and that's what can result in those positive symptoms of hallucinations and delusions. And schizophrenics sometimes don't know why they're doing things. They might think that they're under external control from other people. So they'll do a certain action, but they might think it wasn't down to them, they were under external control from somewhere else. And this is due to a result of dysfunction in meta-representation. They don't understand that their thoughts result in their actions. Another dysfunction is in central control. And central control is basically our ability to suppress any automatic responses we have. So if you're asked a question, then you'd take a few seconds to think about it. There'd be other ideas coming in your head, but you wouldn't just splurt those out. You'd take your time and then you'd give your answer. And the idea is that dysfunction in central control might result in schizophrenia, and especially negative symptoms like speech poverty. So every word that they say might trigger off associations for them, and the patient, schizophrenic patient, can't suppress these responses. So every time they say a word, that triggers off another 5-10 words. They're thinking about those before they can say the next word they want. So that's why we get things like speech poverty and a reduction in the amount that schizophrenics generally say. Now we're going to look at the AO3, and again we're going to divide up family dysfunction and cognitive explanations for schizophrenia. So we're going to look at family dysfunction first. And the first one we're going to look at is family dysfunction by Reed. Okay, a study he conducted where he looked at 46 studies that looked at childhood abuse on schizophrenia. So again, we're looking at dysfunctional family life, dysfunctional homes. He found that 69% of females and 59% of male schizophrenic patients had a history of either sexual or physical abuse during their childhood, or both occurring at the same time. And also, insecurely attached children were far more likely to be schizophrenic. So all of this evidence points towards, if you have a dysfunctional family, you're more likely to develop schizophrenia in the future. So there's very little evidence for the double-blind and schizoprenogenic mother theories. However, Berger did do an investigation in 1965 and found that schizophrenics generally recalled far more double-blind comments and statements from their mothers compared to non-schizophrenic. So again, suggesting that double-blind statements could lead to schizophrenia. However, both of these theories, double-blind theory, schizophrenic mother, were both really assessed in quite an unusual way. It was about assessing the mother for sort of crazy-making characteristics. So the mother would be brought in and the psychologist would assess the mother for what they were looking for. Could this person make someone crazy? And really it seems a little bit outdated now. It's not something that would be done, trying to assess the mother just for their crazy-making characteristics. So a major methodological limitation of these studies is that all the information gathered from childhood experiences was gathered after someone had developed schizophrenia. Schizophrenia may have distorted their recall, and therefore we're dealing with quite unreliable participants. For example, if they were delusional, then they might be recalling things that didn't actually happen. For example, that their parents gave them these double-blind or conflicting messages. So this is a major limitation of the studies conducted. However, some studies have tried to deal with this particular issue and have been conducted prospectively. Okay, so once a child has experienced some childhood abuse, sexual abuse or physical abuse, those children have been followed up throughout their lifetime. And although this prospective evidence does support the theory that if you experience abuse in childhood, you go on to develop schizophrenia, it is only limited. There haven't been many of these studies done. So although it supports it, there are only very few which limits that research. So research into the schizophrenic mother has difficulty in explaining why it only happens in some rather than all children. So why do only some children develop schizophrenia but not other children in the family? And also, why some children suffer similar situations, so some children get abused during childhood, physically, sexually, and don't go on to develop the disorder, don't go on to develop schizophrenia. So it can't really explain these two things. It's a major limitation of this particular theory. Another issue is that we can't establish cause and effect. So Mitchell and Waxler found that there were differences between how mothers spoke to their schizophrenic daughters compared to their normal daughters. But we don't really know whether this dysfunctional communication is a result of living with a dysfunctional or schizophrenic daughter, or if it was the cause of schizophrenia in the first place. So it might be that parents just communicate differently with schizophrenic children than they do their normal children. Or does their communication actually cause schizophrenia in the first place? It's a really hard thing to establish, and unfortunately that reduces the validity of this particular theory. So a very famous study by Vaughan and Leff looked at expressed emotion and how that affected patients who had been discharged from hospital. So when they were discharged from hospital, these patients were recovering from schizophrenia, and they wanted to look at what impact the family would have on those patients falling back into schizophrenia. And what they found was that the more time the patient spent with high EE families, the higher the relapse rate was. So if a patient is coming out of hospital, recovering from schizophrenia, the more time they spend with a high EE family, the higher their relapse rates were. This suggests that the more time they spend with them, the more likely they are to relapse. So expressed emotion is clearly a factor that triggers schizophrenia. However, this doesn't happen in all patients. Okay? Not all patients who have high EE families will relapse, and this can't be explained by the theory. A further limitation of these family explanations is that historically led to something called parent blaming. So you're a parent of a schizophrenic child, you've seen your child develop schizophrenia, you're going to end up looking after them in the long run, probably for the rest of their life. And what we find is that these parents are then given further trauma by being given the blame for causing schizophrenia in the first place. They're either a schizophrenogenic mother, they've got high expressed emotion in their family. They're the ones who the blame's put on. So they're given that further trauma, something else for them to try and deal with, rather than just seeing their child develop schizophrenia, which should be enough for any parent. We're now going to look at the AO3 for the cognitive explanation. So for the cognitive explanation, we're only going to really look at one main study that you can use. And this study looked at the Stroop test, which you would have done last year, an example down the bottom there. And what Sterling did, he had 30 schizophrenic patients and a control group, and they all conducted the Stroop test. And he found that schizophrenic patients took twice as long to name the colours as the control group. So this shows that there's some central control dysfunction in these individuals. However, a main problem is it doesn't tell us anything about the origins of schizophrenia. It tells us that, yes, there must be some cognitive dysfunction in there. Their central control seems to have dysfunction exceptionally, but it doesn't tell us the origins of schizophrenia, which is a bit of a limitation of the study. For all of these theories, you can call it reductionist. Whether you're looking at family dysfunction or the cognitive explanation, they are reductionist theories. Okay? They ignore the biological explanations that you've already looked at, and you can throw in that reductionist paragraph into your essays.